let's talk about self-catheterization. There are different reasons why you might require doing self-catheterization. Some of the reasons are having the surgery, having some neurological disorders, or some people with a very tight pelvic floor can experience transient urinary retention. Having a knowledge and a skill of how to do self-catheterization can save you the trip to the emergency room. For men, there are usually longer catheters. For women, we have a shorter urethra, so our catheters usually significantly shorter, which can actually be more convenient when you're carrying the catheter around. There are non-lubricated catheters and lubricated catheters. The main difference is that the non-lubricated catheters will require you to carry personal lubricant with you and can just make the place a little messier. The pre-lubricated catheters already come with a special solution that helps to glide the catheter in your urethra. The one is not necessarily better than another, it's a matter of preferences and what insurance will cover for you. So when you're ready to catheterize, first you need to find the place where you're gonna do it. Some people like to do it in a shower, some people do it over the toilet, and some people prefer to lay down in bed and do it then. First, make sure that your urethra is clean. If you just came out of shower, then it's good enough, or you can use antiseptic wipes. Some women use the mirror to locate the urethra. Some women do it by feel. I personally think that doing it by feel is easier and it leaves two hands free instead of just one holding the mirror and another one trying to put a catheter in. Sometimes urethra is very difficult to see, and that's another reason why it's better to do it by feel rather than look in the mirror. Urethra located just anteriorly from the vaginal canal, so by placing the finger inside on the forward part of the vagina helps you to glide the catheter in the right opening. So use the index finger of your non-dominant hand and position it in the forward part of the vagina. Take the catheter in your dominant hand and glide it over the index finger, trying to get into the urethra. It should be actually pretty easy. The female urethra is about 4 centimeters long. It's about 2 inches. Once you start noticing the urine coming out of the catheter, it's a good indicator that you're in the right place. Keep the catheter and empty your bladder. When you see that the urine stops coming out, just withdraw the catheter. Once you withdraw the catheter, throw it away. It's not recommended to reuse your catheters. There is no further aftercare is required, and using antibiotics, unless you're treating some underlying infection, is not recommended when you do self-catheterization. So why lubricant is important? Well, lubricant helps to glide the catheter through the urethra, and by doing that, decrease the amount of discomfort you're experiencing. And by the way, the lidocaine gel exists. It's not routinely prescribed, but if you're someone who is very sensitive in that area, you might ask for lidocaine jelly that will help decrease the amount of discomfort even more. So how uncomfortable is it to do self-catheterization? It all depends on your pain tolerance. Some people report that it's just some burning right at the beginning when the catheter goes in, and some people uncomfortable all the way through. So there are actually some tips that you can use to minimize the amount of discomfort. Lidocaine jelly is something that's not routinely given or recommended to patients, but you can always ask your physician to prescribe it to you. It will numb the urethra and it will make the sensation less prominent. Another important thing to do is to do the correct breathing. When you're passing the catheter through, make sure to take a deep breath and relax your pelvis, because if you tense up, the muscles will try to squeeze that catheter and that will make it more uncomfortable. And also keep in mind the catheters come in different sizes. The smaller the catheters, the less the discomfort. And then if you use the pre-lubricated catheter, just hold it in your hands, warm it for about 30 seconds, so when you place the catheter inside, it doesn't feel like cold and foreign. Self-catheterization might not be the thing that you'll look forward of doing, but remember that that's an important solution for people who cannot wait on their own. Some of the problems of overfilled bladder is the backup of urine into the kidney that can cause the kidney damage. So I hope this video was helpful, and please share your own tips for self-catheterization.